In the current healthcare environment, patient or person-centered care is a key concept in providing and receiving care. It focuses on the idea that patients should have an input on the type of care provided to them to create an improved and more personalized experience. It has been defined by multiple different people and organizations, and in this segment we will cover a few. The World Health Organization defines it as an approach to care that consciously adopts the perspectives of individuals, families and communities, sees them as participants as well as beneficiaries of trusted health systems that respond to their needs and preferences in humane and holistic ways. The Institute of Medicine states that it is providing care that is respectful of and responsive to individual patient preferences, needs and values, and ensuring that patient values guide all clinical decisions. In 2006, McCormack and McCants developed a framework to guide the concept of patient-centered care. They break it up into smaller steps to explain each part and its importance in the whole process. These parts are the prerequisites, the care environment, person-centered processes and outcomes. We'll be focusing on the prerequisites of healthcare professionals, which focuses on the skills and capabilities of the registered nurse. These prerequisites include developed interpersonal skills, commitment to the job, clarity of beliefs and values, knowing self, and professional competence.
Effective interpersonal skills can determine if a patient is being cared for holistically. It is the ability of a nurse to communicate at a variety of levels. Interpersonal skills can be justified by nonverbal and verbal communication. This involves listening to our patients and understanding nonverbal gestures. Interpersonal skills include self-understanding on appreciating personal meanings of health events, comforting and supporting patients, as well as encouraging participation by patients in their care by involving them and sharing information. Investing the time and expanding the efforts to understand the world as the patient experiences it results in nursing care that integrates the patient's experiences. As person-centered care revolves around the patients themselves, we as nurses should be taking the time to include them in their care and needs. It is the first step to making them feel comfortable and trust us. If we give them the chance to be included in the decision-making of care, this will allow them to gain trust and furthermore develop a therapeutic trust relationship. Therapeutic relationships, which are developed by good interpersonal skills, are also important for person-centered care. The very first process between a nurse and patient is to establish an understanding that the nurse is entering a relationship with a patient that is essentially safe, confidential, reliable, and consistent with appropriate care. There are many aspects to a good relationship with a patient. For example, a nurse's attitudes toward helping, educating, and involving the patient in decision-making for the best possible health outcomes. We should also show genuineness, empathy, and compassion, so being self-aware of the patient's feelings and building rapport. These are also good examples of commitment. Commitment is one of the most fundamental aspects to a job, especially in nursing, as it expresses a level of respect, dedication, and empathy towards patients, families, and co-workers. Nurses go above and beyond what is expected of them in their job, often working through meal breaks and staying back when their shift is finished to ensure that their tasks are completed and their patients are safe and comfortable. Nurses are sometimes asked to do extra shift or even double shifts where there is a staffing shortage. This can be very stressful on the individuals, but it highlights their level of commitment not only to their job but also to their colleagues. These actions are performed because they want to provide the best care, not just because they have been asked to, as they have an innate sense of responsibility, empathy, professionalism, and commitment to care for their patients in a holistic manner. Nurses demonstrate commitment on many different levels, working within the structure and values of the environment that they are part of. All institutions are bound by policies and procedures, and it is the nurse's responsibility to know and understand these and work within these guidelines. When working within a team environment, nurses share their personal beliefs and values so that they can all work towards a shared vision, providing continuity of care for their patients, and in order for this to happen, there must be a commitment from them as a group. It is a very anxious time for patients coming into an unfamiliar place such as a hospital environment, and it is very important for us as healthcare professionals to ensure that our patients receive the best care possible and that all their needs are met. Nurses are committed to ensuring that families, where possible, be involved in the care of patients, which enables them to feel more relaxed, and it provides an important factor in the patient's recovery process and ongoing management. Along with nurses, there is ongoing commitment from organisations to provide mandatory education to all personnel to ensure staff keep up to date on policies and procedures. which continues to ensure a safe and professional working environment. As human beings, we all have different values, attitudes, and beliefs that we develop throughout our lives. Values are qualities, the principles that an individual holds which help them to live and behave within society and with each other. According to Manley, values determine what people think ought to be done, and these are closely linked with moral and ethical codes. Within nursing, patients' values are highly important and must be respected when being given care to avoid any kind of obstacles in their treatment. One's beliefs are a vital part of their identity. They reflect what people think and how they view themselves and others. Beliefs can be defined by what people think is true or not true. An example of respecting beliefs within nursing is listening to the patient's preferences and increasing their satisfaction with care. Quite often, patients of different cultures will have specific ways in which they want to be cared for and can have restrictions on the level of health care given. Respecting patients' values and beliefs with no judgment and always ensuring to listen to them are key aspects in gaining their trust and is a crucial part of communication in the healthcare setting. The nurse must always be aware of these different views in order to know how their patient's values and beliefs can affect their treatment and care. This can be done by simply asking the patient prior to providing the care and treatment, or through research and understanding of different cultures. Knowing self is the next step outlined in McCormack and McCancer's model of the prerequisites for nursing. Knowing oneself could also be referred to as being self-aware, a condition that requires constant reflection and feedback. Self-awareness in nursing is the ability of a nurse to separate their own needs, thoughts, and feelings from those of the patient. Self-awareness is developed using personal reflection. A helpful tool for reflection, called the Johari Window Model, was created by Joe Luft and Harry Ingham in 1969. The model is separated into 4 quadrants: open area, blind area, hidden area, and unknown area. The open area represents what a person knows about themselves and is willing to show to others. The blind area represents characteristics or behaviours that others may be aware of but are unknown to the individual themselves. The hidden area is what the person knows about themselves but is unknown to others. The unknown area is an area that is unknown to both the person and others. This may be hidden talents that are later to reveal themselves. A change in any of the quadrants will cause a change in all the others. The goal of the Johari window is to move characteristics, ideas, and behaviours from other quadrants into the open area. John Sanders writes that self-regulated and lifelong learning have reflection as an essential aspect, and it is also required to develop both a therapeutic relationship and professional expertise. To successfully reflect, a person must be willing to ask others for feedback. A study performed with third-year nursing students showed that feedback has the ability to enhance the students' performance and make them feel confident and competent in their role, especially when the feedback is immediate, thus allowing for reflection in practice. There are a number of prerequisites outlined for safe practice in nursing. It is important to know and understand how these key values contribute and why they should be implemented.
Being professionally competent requires certain skills, knowledge, and attitudes which contribute to providing the best possible care for patients. According to McCormack and McCain, 2010, within the person-centered care framework, being professionally competent is defined as the knowledge and skills of the nurse to make decisions and prioritize care, and includes competence in relation to physical or technical aspects of care. When it comes to delivering patient-centered care, McCormack and McCain 2010 referred to the level of competence being more than simply undertaking a task or demonstrating a desired behaviour, but is more reflective of a holistic approach that encompasses knowledge, skills, and attitudes. As part of becoming a registered nurse, you have a requirement to deliver up-to-date knowledge and skills to our patients. As part of your registration, continuing professional development is a mandatory requirement where nurses have to take part in education and training relevant to the workplace or for further personal development. The Nursing and Midwifery Board of Australia 2017 defined continuing professional development as how nurses and midwives maintain, improve, and broaden their knowledge, expertise, and competence, and develop the personal and professional qualities required throughout their professional lives. Professional qualities through personal development, experience, and attitudes help implement and deliver a better environment for our patients and effective person-centered care. Participating in any mandatory training within your workplace can help develop skills allowing you to gain further knowledge required to provide the best and appropriate level of care for your patients. Working collaboratively can help you as a registered nurse develop valuable skills, attitudes, and knowledge towards providing better health care and possible outcomes for your patients. Patients often feel more comfortable and at ease when they have confidence that the nurse looking after them has a positive attitude, is knowledgeable and competent at the skills required for their treatment. These key values, together with the previously discussed attributes, are needed to provide an effective level of person-centered care.
The leadership challenges that one may encounter when integrating these components into real-world practice include nurse shortages, constant change within the healthcare environment, and the diverse amounts of ethnic groups receiving healthcare. A nurse's commitment to the job can be restricted due to a shortage of nurses. This could be due to budget cuts, nurse burnout rates, and lack of interest in specialised areas. A lack of nursing staff will lead to an increased workload for the nurse and therefore will inhibit their ability to go above and beyond in areas such as individual availability for patients and their families. This is because the nurse may be struggling to manage their increased patient load while also maintaining safe practice. Another challenge includes the persistent change within the healthcare environment. Nurses are constantly expected to increase their skill level and expertise to maintain professional competency. Therefore, every nurse must be willing to change old practices and learn to adapt to new methods that align with evidence-based research. This can pose a great challenge for nurses, as habits and preferred methods can be hard to change, but in order to deliver quality care, it's essential to have an open mindset and an eagerness to learn new practices. Westford describes communication as a two-way process, and effective interpersonal communication, either verbal or non-verbal, can be difficult due to the language barriers that exist between nurse and patient. Australia is very multicultural, with immigrants from over 200 countries. While the healthcare system does its best to accommodate for language barriers, the use of interpersonal skills can never be fully achieved with patients who experience a language barrier. Due to the constant influx of different ethnic groups receiving healthcare, it's impossible to have a comprehensive understanding of all the beliefs and values they may have. In order to prevent conflict and harm from arising, one must have an understanding of their own beliefs and values through understanding cultural safety and self-awareness. Also, if a nurse does not continually use reflective tools such as the Chihari window, the development of therapeutic relationships and their professional expertise will begin to suffer. Reflection as a nurse highlights the importance of knowing yourself and how this knowledge can enhance the quality of care given to patients.
Practice and nurse-led innovations into person-centered care are essential for creating a more comfortable and safe environment for patients. These innovations are necessary to improve and advance healthcare processes. A good example of this is displayed in A Comfortable Cover-Up by Jenny Kendall. This is a great example of a nurse-led innovation because it focuses on finding a way to make patients feel comfortable when they are in hospital. Kendall worked as a nurse in New Zealand and noticed that garments given to patients for theatre weren't very modest, with open-back gown and one-size-fits-all pants. Kendall noted in her recap that patients of all ages were feeling very uncomfortable and uneasy in these garments, especially Maori and Pacific Islander patients, who usually had their legs covered. Kendall saw this was causing the hospital to make patients feel vulnerable and not creating a safe environment for their patients. Kendall wanted to change this and create a safer and more comfortable hospital environment. To do this, she travelled to hospitals in the Pacific Islands to see how they dealt with making theatre visits more comfortable for patients. Whilst visiting, she saw that hospitals would have patients wear a lava, a wrap that would be worn around the bottom half of patients, and a top to keep the patient more modest when going to theatre. She took this idea back to the hospital in which she worked in New Zealand and presented it to the theatre manager with an idea to trial a lava or blanket to cover the patient more modestly in operating theatre. This was approved and a 3-month trial began. This trial offered all ethnicities the option for a blanket around their midsection when going to theatre, and Maori and Pacific Islanders were also given the option to have a lava as well. At the end of the trial, 85% of the 99 responses were positive and supportive of having an extra garment to cover them. During this trial, other departments asked to trial the use of the garment too, with more positive responses. In the end, the initiative was officially implemented in the hospital in September 2008. Kendall stated that the use of the extra garments had made patients feel more independent and be more comfortable when being mobile sooner after surgery. This shows that this is a great nurse-led innovation, as it made patients feel more comfortable, safer, and also helped to reduce patient anxiety. These things combined help to make patients feel better sooner and also help to build patient confidence in the hospital and healthcare staff, because it shows that their comfort and well-being is cared about.